University City.
The next stop will be University City Boulevard Station.
Hello everyone, I'm Janelle Goodrich with University City Partners, and today I'm thrilled to be speaking with Dr. Lauren Pepper, co-founder of Innovation Health. Innovation Health is a clinic that blends chiropractic care with holistic approach to overall well-being, with Dr. Lauren's husband, Dr. Brad Wolf, working alongside her to help patients live their healthiest lives. I was Innovation Health's very first patient when they moved down here to Charlotte, North Carolina. I don't know if you remember that or not.
I did not know that you were our first, but I knew you were one of our first because your
You
office
hadn't
was right next door to ours.
Yeah, they hadn't even set everything up. I'm in there with boxes and we kind of just push things out of the way. Because why? Because Dr. Pepper here, she was aching to get a hold of a body to work on some kinks, and I gladly, volunteered to do that. So.
And how did it work out for you? Were you good?
Oh my gosh, oh yes.
I mean, she kept coming back, so I guess that means that.
Yes. I really want to talk about what you've got going on and really what sparked your interest in holistic health and how has that changed over the years?
Well, I guess, the spark began when you start seeing like healing happening. That's the spark, right? And it started happening with me because I had an injury when I was 16. I spent 100 days in the hospital healing and needed to go to the chiropractor, which is another story, but that's what sparked me. So the spine became very significant, and I learned early on the relationship between the nervous system, the musculoskeletal system, the brain, the gut. Everything it goes through the lifeline, which is your spine.
Diet is just so much easier to go to McDonald's or some of these other places for fast food or a pre-prepared dinner out of a freezer section at the grocery store than it is to make something for a lot of people. And I imagine a lot of those chemicals in there also are leading to a lot of issues that young people have.
But I will say overall that habits are key to things. It's not just, like a balanced diet, it's really habits. So like in the Pepper Wolf home, we do meal prepping. We might not get all the fancy lifestyle, but we get the higher grade food, because it matters. Is what you're eating good for you? Because people come to me sometimes, Janelle, and they'll be like, I'm really eating healthy. I'll eat salads and feel terrible after I eat a salad.
Yes.
Right?
Bloated.
Yes. And so I started hearing that a lot when I was first beginning. And that's actually why I kind of got into more of the functional, because I had so many patients. When I was distilling down why they were coming in for the pain and inflammation, I'd ask them better questions, and I would ask them about their digestive health. And yes, sure enough, they're bloated. They don't feel so good after they're eating. And I won't get into more descriptives at some point. But the key is that you want to uncover what's causing that, right? I run lab work because I think it's important to look at the cells and to know what they're needing. And I don't guess. I don't think guessing your way through healthcare is a good idea. Not everybody's going to go well on one thing, whether it's a nutraceutical or a diet or even a pharmaceutical. You got to make sure it's right for that person. That's why there's so many adverse side effects in the pharmaceutical world. It's because it's not a one-size-fits-all.
I'm going to talk about women's health in particular and how we kind of can be overlooked a little bit, and if there's any advice that you can give to people and some key areas that we should focus on.
I think that women have been experimented on with their hormones a lot, and they were led to believe that, oh, don't worry about it, you can just fix it with a pill, any pill for that matter, and you'll be okay. Everyone has to be responsible for their own health in a lot of ways. So just because a doctor is saying, hey, you need to do this or you should do that, doesn't mean you have to. And I tell people, try what your doctor's telling you, and if that approach is not working, then you should actually continue to look outside of that box, and that's when people usually end up coming in to see a functional medicine chiropractor.
I know we briefly talked about the pandemic and you and I kind of struggling with all of that. You want to talk a little bit about some of your personal challenges of kind of getting back into the swing of things, especially when you're talking about, you are hands-on with people, and it's challenging in that whole healthcare community period.
You know what? That actually, I think, is what helped me through it the most. Because we didn't close down. We stayed open. Everything is private. They go right into the private room. Mask, no mask, vax, no vax. We didn't stop anybody. Everybody was welcome. So we got a lot. We actually did really, we did well. Not in the sense where it wasn't challenging times, because it was. And we were figuring out, but we were already doing this work, where we were already in the natural healthcare world. So we just continued doing I started running labs on people. I started looking for what was going on, and then getting them on different protocols, nutraceuticals, strategizing, whatever we needed to do so that we could help them, and going back and rechecking and just making sure. So we were already doing it. It just kind of fell into, okay, what do we need to know about this now? This thing that they're calling a virus. And then people started getting the vaccines, and the vaccines came in different forms, and nobody really is 100% clear what's in those vaccines. So we didn't know what we were dealing with. So we had to go a lot with symptoms. And then, of course, I started learning how to add other lab work to my panel to make sure people weren't having trouble with blood clots and that kind of stuff, because that was happening. And that would actually recommend that everybody that gets this, that listens to this, that if they get a spark of anything that feels right around this conversation, and they want to come in for chiropractic care, we're really for that first examination. It will cover everything, and it'll give you an opportunity to learn what it is that we do and what we're about, and how we might be able to help you. So,
I know we're about out of time, so I'm going to just sneak in one last question about stress. And just so you know,
that's a little question.
Just preparing for this, I got a little, stressed out, so Dr. Pepper was able to help me calm down immensely. So I don't know if you want to kind of talk about how stress impacts our lives and our physical health and all of those things, because I could just feel like I was coming out of my body with this. So.
And how do you feel now?
I feel wonderful.
That's fantastic.
Kind of, yeah.
Are we allowed to say what we did?
Yeah, I don't see why not.
Okay. Yeah. I don't sell, I'm not going to even tell the name of the product, but I noticed what was going on, and there was stress, and she was a little amped up. And, getting in front of camera is never an easy thing. We start to overthink it. Yeah. And so I just have some different strategies that I use. And so I gave her homeopathic, some drops underneath her tongue, and I said, just wait 30 minutes before you swallow it down, and let's see how you do. Yeah. And what did you notice?
I just, it just sort of lifted off of that tension. It's like this vibration that happens inside of me.
Yeah. And so quiet down your brain.
Yes.
And then your body was able to get calmer. That's kind of what that particular. And I just I keep that for acute stress, and my patients love it. And it's such a nice thing for not everybody, but for the people that test for it. They find it really helpful. So I'm glad that it worked for you.
I'm a little high strung.
So stress in general, just to answer your question, because I know we have to wrap this up, but it's not an easy question. It's not a quick question to answer, but I'll do my best. Stress impacts everybody in some way, shape, or form. I see stress as either it's going to steal the energy and resources within a person's body, because that's what it can do. But the body is set up to handle all kinds of stress. We are meant to be adaptable. So when I see stress, I look for ways to bring the body back into a place of adaptability. But the key is to find what you can do to bring the body back into that present state, so it's not thinking 5 steps ahead, or it can't quiet down. And so being adaptable is probably the way that we've survived life. They say it's survival of the fittest. I actually think it's survival of the most adaptable.
Yes. You can go visit Dr. Pepper and Dr. Wolf over at Innovation Health. They are actually over on University Executive Park Drive. And we hope this conversation has inspired you to prioritize your health and well-being. Follow their website, ihealthnc.com. Until next time, take care and stay healthy.
University City. The next stop will be University City Boulevard Station.